Hi everyone, this is Sarah from Exhale and Wander, and today we have Dr. Lisa Chow, who is the sight doctor, and I'm super excited to have her on. Dr. Chow, can you share a little bit about yourself with us?
Absolutely. Thank you for having me here today. I am a neuro-optometrist, also known as the sight doctor. And as an optometrist for almost over 15 years now, I have had the opportunity to really take care of my patients when it comes down to the eyes and the ocular health. And more recently, the last 5 years, I stepped into neuro-optometry. And neuro-optometry essentially is how well the brain is processing the visual information. So it's not just about 20/20 vision, but also about how well the brain is understanding what we are seeing. And so from there, I've spent a lot of time with people who've had either a concussion or a brain injury or any type of neural brain concerns that is affecting vision. For example, learning related vision problems, and as well as lazy eye turns, sports vision and performance, and to name a few. So I'm very excited to be here today.
I love that because I am going through quite a bit of those. So, very relatable. You kind of already shared a little bit about how it's not just 2020, but can you share the difference between an optometrist that we normally see and how that differentiates with neuro-optometry before all the sports stuff?
Absolutely. So most people, they go into an optometry eye exam, and what the optometrist would do firstly is to take a look and measure how well you're seeing. And that's when we talk about 20/20 vision, how clear you're seeing. Then we will take a look at some of how well the eyes work together, and then look at the front surface of the eyes, the health portion of the eyes, take a look at your prescription, how well we can see, and that's where all the glasses come in, the one or two, which one's clearer, and then that's a comprehensive eye exam. Now, the part that I kind of just skimmed through is when they're taking a look at how well both eyes are working together. It's a very quick screen, and it's just to take a look and see if we are able to see clearly and if the eyes are moving well. Now, as a neuro-optometrist, when the patient comes in, we are doing a much bigger assessment. We're taking a look at how well both eyes work together, how they team together, how well we can focus and keep things clear, how well we can see 3D vision, which relates to how well both eyes are fusing together and navigating the world around us. So I'm also taking a look at how well you're seeing at central and at your side vision at the same time. And what happens when there's motion? What happens when we make things harder? How
Mm.
does the brain process that information? And so that's a big part of a neurovisual assessment, is to take a look at the whole picture, zoom out, take a look at the whole picture, and also look at how your visual system is and whether or not it's affecting your daily functional tasks. For example, when you're reading or on the screen for long periods of time, we want to put together the picture, the idea, and understand the whole visual system as a whole when it comes down to the brain and vision integration.
Mm. And I love that you're already tapping into the visual system. I'll use me as an example. When I had my concussion, I couldn't see in my right peripheral specifically, and I had a lot of like blind spots I couldn't even realize were blind spots. And it wasn't until the testing that we actually found a lot more blind spots in both eyes, even though I only felt it or was aware of it on my right. But even then, I didn't really understand what a visual system means. Um, I was diagnosed with binocular vision dysfunction. I didn't understand that. And then I also had spatial dysfunction. I didn't understand that. Are those part of the visual system, and or what are the visual system made of?
I love this. I love this question. And thank you for being vulnerable about this because it must have been frustrating being in an exam room and not truly understanding what the doctor is talking about in terms of your diagnosis. And so I'm very happy that you asked this question because at the end of the day, we want to zoom out and look at the bigger picture. And so when we talk about binocular vision dysfunction, we're taking a look at the eyes together, how well both eyes are working together. And when both eyes are not working together, then there's a lot of symptoms that can surface that people may just think, oh, I feel this way. Maybe I'm just tired, or I'm getting a headache. Maybe I'm just tired. But many times it can also be eyes. So binocular vision just means how well both eyes are functioning together and teaming together. And so some of the parts of the visual system, similar to what I was mentioning before, is when both eyes work together, we're able to fuse the image together so that we can see single, for example. And then when we fuse the image, then we start seeing 3D. And then once we start seeing 3D, then we can start understanding the world around us. And so when we're talking about spatial awareness or spatial dysfunction, then that's pretty much where the brain thinks we are in space compared to where that object is. So we want to be aware of our surrounding and understand that even though I'm looking at you, everything around us is still there. And if there's a lot of motion, can the brain process the information in an efficient way and so that we can still feel safe and stable in our environment?
Wow.
And so when you're talking about like side vision, for example, these are some of the things that we look at as well.
When you mention side vision, where is that? Do they talk about it as peripheral vision? Is that what they're referring to? Okay.
Yeah, it can be many names: side vision, peripheral vision, spatial orientation. Um, there's other terms too.
Okay, this is helpful because I feel like either we kind of feel it, but we don't know what the terminology is, and we don't know it's a thing, or people talk about it, but when we have a concussion, we're probably not at the best space to interpret and understand everything that's new. So it's really nice to kind of have a word bank for it, per se. For me, it's interesting because when I went to the ER, they check the basic stuff with your eyes and whether you're able to see their finger and then touch their finger. And the at the time, people were like, okay, you're fine. But I'm over here like, I'm not. I'm when I reach for something, I think I'm about to reach you, but it's like further. And then I was seeing fisheye, but I couldn't communicate that. And it wasn't just fisheye, it was like the top part was like slanted away. It was this weird thing, like, how do I communicate that in the ER when I'm not even, you know? So if somebody does experience those things during a concussion, what would you recommend they say or they ask?
So, number one, give yourself grace because right after a concussion, there is so much going on. Your whole world has been turned upside down. There's a lot of people around you, and the environment is already probably moving very fast. And especially when there's an initial change to how your brain is processing everything around you, that initial impact or hit or just a whiplash, all that there's a lot of biochemical changes that's happening at the same time. And the body and the brain is trying to stay safe. And so during that time, the main thing your body has to do, your brain is doing, is surviving. And so it's regulating your nervous system immediately. So think of it like this. We're trying to understand what's going on around us, but the brain is exerting so much more effort to try to survive and make sense of what's going on. And so so it makes sense, and that, cognitively, attention-wise, things are not as sharp as before, right? Because during that time, the brain is using a lot of effort to survive, essentially, to make sense of what's going on. And so give yourself grace for that, and if you don't know, for the viewers here, if you don't know what to say immediately, that's okay, and just the main thing is to just understand that there are support after. And a lot of times when you feel like, I don't feel good, but the other person across from me is saying that I'm fine, don't take it too much, of a diagnosis or whatnot, because at the end of the day, at that moment, they are taking a look at urgency. And so what they're saying is reassuring, and at the same time a little dismissive, because I don't feel good right now, right? But understand that at that moment, it may feel very confusing and all that. The main thing is just, how am I right now? Am I stable? And if they say, you know what, you're fine right now, then you know what, take it one step at a time, and then really kind of take your time to experience how you actually feel. Because you know yourself best. You know how you felt before the accident and who you are before the accident. And so give it some time, because the brain is trying to process everything at that moment. And then over time, it's going to come back to a level where, okay, I feel more safe. And then some symptoms get better. For example, people feel disoriented. They feel imbalanced immediately. Over time, they start feeling more stable. Maybe not to the extent of normalcy, but to the extent where I feel a little bit better.
Right.
Would you say that was your experience as well?
Sorry, I'm getting emotional.
It's difficult because the brain, even when we're talking about this, the brain remembers, and remembers the body, and remembers how we felt at that moment. And so emotions will come up, and I experience this every day with my patients too.
I didn't think that talking about it was going to bring up the moment. When we do take it step by step, at least in my experience, after the ER, the next thing was like a follow-up with my primary care. But how do we get to seeing a neuro-optometrist? Like, how does that transition work?
I'm so glad you brought that up. I have a mission right now, and that mission is to really bring people an awareness of the fact that we are here, a neuro-optometrist, and we are here to help people and assess how well the brain and eyes work together. Because I've been doing this for many years, and a lot of the people that come in to see me has voiced out that I'm their last option in terms of what they're feeling, and that's how come I've never been referred to you before, or I've never even heard of you before, and I feel like this is where, I want to bring it out more to public, because, and now here's the thing, a lot of things happen in between when it comes down to concussion. There's a lot of people involved because this is a multidisciplinary approach. When it comes down to concussion, it's not just about one thing. People go through a wide variety of specialties. physiotherapist, occupational therapist, chiropractor, massage therapist, psychiatrist, general practitioners, neurologists, and that's just to name a few. And so when it comes down to invisible symptoms, like let's say after a while, we still have these persistent symptoms, including vision or like headaches that won't go away, dizziness, difficulty reading, difficulties concentrating, and difficulties just seeing things and understanding what's going on. And even if the things are too fast, what I want people to understand is that all this is sensory input. Everything comes through the eyes. The brain has to process the information. So the long story short, to answer your question, one of the main things is to explain to your family doctor and explain to your eye doctor. Because eye doctor, when you go to the optometrist, you don't need a referral there. And so when we go there, speak up, explain to them how you're feeling when it comes down to your eyes, when it comes down to how you're having a hard time reading, symptoms come up quickly, you've had a concussion, or you're experiencing these symptoms, because there's a way from there to be referred to a neuro-optometrist, or even myself, people self-refer to us too. We don't need a referral. So that's
That
another
is
thing too.
huge.
Yes, you do not need a referral to come to see a neuro-optometrist. Just like you don't need a referral to see an eye doctor. Okay, optometrist. All right.
That is huge because almost everything, like you mentioned, the occupational therapist, the physical therapist, all those things, I never even got to that. I got stuck at primary care, neurologist, and then eventually I was like, this neurologist is only giving me medication, and I never even got to physical therapy. I didn't get help with occupational therapy. I was asking for it, but until certain things were cleared, I couldn't get there. To have someone else that we can speak with as an option without needing a referral, in my opinion, is massive to at least get some documentation started. So,
Absolutely.
yeah, I just realized I didn't answer your question earlier. I'm so sorry.
And that's okay.
But to answer that question, um, little by little, certain things did get better for me in terms of my vision, but it's taken a really long time. And I would say, even now, my eyes, I don't think, are teaming together when it comes to depth. I think they are teaming better in some areas, but there are certain spots where my eyes are struggling to come together, whether it's certain spots if I was to look at a circle, or certain spots if I was to look at distance. Is that a thing?
Absolutely. So think of it like this, up close when we're on our phone, when we're reading a book, our eyes have to come in together to keep that single. But what happens is that now I'm watching TV. And so rather than getting the eyes to bring in up close, we're actually bringing the eyes outward a little bit, but to a point where it still converges, like still bring teams together. So these are the different types of visual demand that we assess too, because we know each other, we know ourselves the best. And so we kind of know our baselines before the accident. What we do when I see the patient is we actually do, it's kind of like baseline testing again, but it's after the injury, right? And so I'm taking a look at all these areas of your visual system and see how much demand is the brain using to keep things single and clear. And of course, if we had a baseline before, then that's wonderful because then we can compare, right? But afterwards, at least that initial baseline of after the injury, we have something to compare with once we start vision rehabilitation and vision training. So you actually brought up a good point because concussion is many times I see a lot of people after sports concussions. And here's the thing, in the athletic world, they know about baseline testing. They know about they think of it as baseline testing for performance. Let's take a look at all the different systems and see what the baseline is so that if, knock on wood, there's a concussion, there's something to compare with those data, right? But either way, even in this athletic world, the baseline testing is not as comprehensive when it comes down to vision. And that's something that I would like to advocate as well.
This is a very interesting way to kind of like talk about it, because as someone who was a former dog trainer and has loved and been part of sports like my whole life, and like movement is I mean, I was like, I have ADHD, very, very obvious, and I needed to move. You are right in the sense of, even in my experience, trying to understand what my baseline is and learning how to communicate what that means is very specific to the sport, not necessarily to the eyes. What does understanding your baseline mean, even without sports? And how do you test for that?
In a normal eye exam, we just essentially look at the clarity and then the health of the eyes. And so we don't really go specifically into baseline vision testing. And that's where if someone was to come in to the neuro-optometry, the specialty office, and they say, I want my visual performance baseline, then that's another way of looking at it, because you don't have to go through an injury to get this assessment. And the reason why is because people are starting to feel like I want my efficiency to be better in this modern world, for example. And yes, they may have some subtle symptoms. Oh, I get tired. Oh, I'm having, I get so tired easily, or that I'm not focusing enough. For those who want better visual efficiency, they can actually come in and do a baseline vision testing to see where they are. And here's the thing, these are the terms: baseline vision testing, or a binocular vision assessment, or a neurovisual assessment. There's so many assessments. The main idea is it's all the same. It's how well the eyes are working together. And so when you're asking me, what are we assessing? It's all the things that we discussed earlier. How well your eyes team together, how well your eyes are focusing, how well you can see at different distances, how well you can bring your eyes together up close and keep it single and clear, and at what point, when it gets too hard and everything turns double, or you have to close your eyes to feel better, right? So these are the baseline testing I'm talking about.
When I went to go see a neuro-optometrist, I read up on how binocular vision dysfunction can sometimes like mimic ADHD, whether it's the chicken or the egg that came first, it seemed to be really helpful to introduce even to kids as they're like entering just the reading phase and all that, because then they get tired fast. At what age do you think this would be good for like parents?
I love this question. And here's the thing, like when we talk about ADHD or attention or any of that focusing concerns, for we can do a binocular vision assessments really early on. And I would say if we were to pick an age, like many of my infant patients, they come in, I see them because their eyes are turning out already or turning inwards. And that's very visible. And so that's when I see the babies, okay, the infants. But what happened is that most parents start getting concerned when the child starts reading because, oh, how come my child is not reading at a certain level, or they're not paying attention, they don't even like reading a book, and that's when, we do that assessment to see. Because a lot of people, I'm glad you mentioned ADHD and neurodivergence, because some of the symptoms overlap when it comes to taking a look at the visual system and difficulties with reading. Because when we're taking a look at difficulty reading, it might not be just attention concerns. It could be that the brain is having difficulty tracking what they're reading, and that they're skipping lines, or that they're confused with B's and P's and D's, the reversals, or that they're not able to read efficiently and then jump to the next line. And so to answer your question, I would say school age is a good time to really hone down and see how their visual system is, and whether or not, if people are thinking, oh, I want to diagnose them as ADHD or neurodivergence, to also consider, before we jump into that conclusion, let's also take a look at vision, because vision, the symptoms also overlap and can
Yeah.
mask.
Being on ADHD meds and seeing how it affected me was very much like, wow, things are so much better when I'm on ADHD meds. But after my concussion, because of the binocular vision dysfunction, just how much harder things were that were already hard before was like over my head. It was so, yeah. And and as my binocular vision dysfunction gets better, then okay, it's starting to feel like how it was before with just ADHD. But when you're a kid, you don't really have the luxury of being able to say that, or have those words. I can also see how it can also affect development in terms of like coordination, or, how they function with like athleticism. Can you share other moments where this could affect how they perform in just like day to day and understanding their body?
Absolutely. I'm going to share a quick story about a child, a little girl that came in, and essentially she was very, very shy. Her hair was down, and when she came in, you can see that she's shy, she's um, scared maybe, and just kind of low energy, maybe not as confident. And as I'm assessing their vision, more the more I realize that, what, maybe specifically, how well their eyes are teaming, because they may be actually seeing double vision, and like even though their eyesight is good, they're seeing like words moving on a page, and like things are difficult for them. And so, more specifically, children, they can't really explain that, because some of the times they might think that everyone sees it like this, or that, oh, things are blurry at distance, I guess everyone else sees it. We can still guess what the word is, And I guess that's how everyone else sees it. Like we wouldn't know. So what happened, I remember, is that I prescribed glasses for her. And this is just a normal exam. And I remember after the glasses, after some of the vision training, a couple of months later they come back and they're totally different. Hair is back, her posture is more straight, she's so much more confident. So to answer your question, when it comes down to how vision can influence so many other areas in your life, it's how well we can interpret the world around us, how efficient it is, because that there's a real correlation between that and confidence, how they present themselves, and even movement. They would, when I talk about movement is all part of vision because that's how we understand the world around us. And so the more we do that, the more we are actually learning. So yes, the brain is taking in all the light, detecting it, and processing the information. But with movement, with how we interpret the world, that's how the brain learns as well.
That's such a good way of putting it, and you bring up confidence because even with like me as an adult, the moment that I could feel like I'm seeing fisheye, the stiffer I got, and the less likely I was to move because then now moving made me anxious. Now, with me being more stiff, my body protecting me even more, then I shrink exactly like you said, and that's me as an adult. So, all the more as a kid who is still learning more context about the world.
Absolutely. It's a cycle. If we're unsure about something, and that can cause less confidence or influence confidence, posture, all that. And then our field of view may narrow too, because it's all system regulation, our nervous system, how we regulate. And if we feel unsafe, then the vision side of it starts narrowing and then the whole body shrinks. And like these are all mechanisms and it's all nervous system regulation as well. So it plays a huge part, in terms of how we learn and how we interact with people around us and the world around us.
I kind of, if you don't mind, stick on like how this relates with kids and development a little bit more, even though like talking because I had my concussion and for that audience. But I feel like when kids are learning the connection of like their right arm with their left leg and their left leg with their right arm, like I don't know the terminology for that, but I feel like the different parts of their body team better when the eyes also team better. What may be clumsiness, I'm interpreting as, oh, something with the vestibular and the eyes are off, and I'm not sure where it is, but how can adults support kids that are in development and spot that to be like, oh, I should maybe bring this up?
Absolutely. Let's talk about vision development from an infant stage. I'll keep it short and simple, but the idea behind it, and I'm gonna talk to all the new moms right now, new parents right now. Essentially, remember when we talk about tummy time, and belly, that is actually a very important milestone there because the belly, when the baby is on their belly, that first year of life, what they're doing is when they're on their belly, they're just looking left to right. And that is the area of the brainstem where the pons area where they start looking, and that's forming horizontal tracking. Okay. And that's vision, how well you can see left to right. Over time, a couple months later, they start crawling. And when they are crawling, they're higher up slightly. So now they are forming horizontal tracking and vertical tracking. And this is the midbrain area and that perception. And so a lot of people, a lot of kids, they rush, 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 you know. Okay, maybe if I skip the crawling, I'm going to go straight into butt scooching and then pulling themselves up. But what I want parents to understand is that we actually want these milestones. We want the child to be crawling more, because that is when they're interpreting the world, and that's when all the horizontal and vertical axis are forming. So that is when the eyes start to align better and fuse better. And so you'll be surprised where when we are working with people who have misalignment with the eyes and they're very young, let's say they're like 2, 3 years old, we're actually doing floor exercises, because we can't really teach the brain how to crawl. And these are all innate. These are all the brain doing it. And because that's vision development, this is normal development. And so as the brain starts developing, then certain areas of the brain, let's say the left and right hemispheres, and there's an area called corpus callosum. This is where one part of the information goes to the other part of the brain. And that's where people start thinking about reversals and mirror images. Oh, this cat is facing this way. Oh, but is it the same as the cat facing the other way? You know, and so the brain is trying to make sense of the world in that very first year of life. And so what I want to introduce and tell parents is tummy time, you know, crawling, belly crawling, army crawling. Those are milestones, and those are like don't dismiss those times, you know,
Yeah,
because those are the basis of vision development.
that's
When
amazing.
they get Yeah, absolutely. And then when they get older, you know, now we're taking a look at how well the eyes can track, you know. And so I'll give you an example. In the early stages, the child is probably using their fingers to read, because that makes it easier, and then they're not skipping lines, okay? And then what happens is that, let's say they don't use their fingers. Are they skipping lines? And maybe in the beginning, that's okay, that's normal. But we also want to see individually, you know, can they learn from it? And is their head moving while they're reading? Or can they keep their head still and then just use their eyes? And so these are some of the things, some of the signs that I want parents to kind of notice. How well does the child fixate on something and keep still, and also how they're tracking with their eyes, and whether or not the head is moving. Because if the head's moving to compensate, that's the brain's way of saying, you know what, that's too hard. I'm just going to move the head to follow. And you'll be surprised, because a lot of kids do this. And up to a certain extent, we want the child to be able to do it efficiently. And so all this can be trained as well. It's more, let's see how the child develops over time first. But these are some of the signs that I want them to take a look at. Same thing with cover one eye, cover the other eye. Do you notice a difference? Because kids do not do that. Even adults don't even think to cover one eye to see if there's a difference.
Yeah, I definitely didn't until vision therapy. Do neuro-optometrists in general also provide the vision therapy, or is that something you have to request?
No, absolutely. So neuro-optometrists, they are trained as well in vision therapy. And what many of them do is also train a vision therapist. So the vision therapist is under the neuro-optometrist, or neuro-optometrist can also be referred as behavioral optometrist or functional optometrist. Okay. And so how we know this is because they focus on the binocular vision, on how the brain is processing the information. And so when we're talking about vision therapy, the person is actually doing all these activities to stimulate different parts of the brain. And the more they do something over and over again and add in challenges, like kind of like a workout, add in a little bit of weight, then that's a way of retraining the brain to have things done more efficiently. And so
Mm.
that's a term, neuroplasticity, where that comes into play.
You mentioned earlier the sensory stuff, when the brain is having a harder time trying to receive the input and it becomes inefficient. There was a point where, and it still happens, but in the first month or two of my concussion, when I looked at stuff, it's like the words, I could visually see the words, I couldn't understand it. And it didn't matter if it was in English or Tagalog. I just couldn't understand it. It was like just floating there, and it was so frustrating. Thankfully, it doesn't happen as much anymore, but it still sometimes can. And when it gets bad, it's the same with images. I could see it, but I can't remember the word for it. And what does that mean exactly, and or why does that happen with our vision?
Well, think of it like this. In order for us to kind of really understand what we're seeing, the brain is actually exerting a lot more of effort to, number one, get our eyes to keep the image single and clear and understand what we're seeing. Now, when we talk about vision, we're also talking about visual memory, visual processing. We're taking a look at if the brain can understand the spatial awareness around what we're seeing. And all that together is how the brain learns. So, before the injury, especially with people who have ADHD or is diagnosed with neurodivergence, many people have coping strategies or strategies that they put in place for a long period of time over time. And so it was their way of seeing and reading and understanding. And now after a concussion, that brain reserve doesn't have much reserve in terms of understanding what we're seeing. And so when that happens, it may seem like, oh, how come all these symptoms are worse? And here's the thing, many times it's temporary, and that's what you're experiencing as well. I feel better, and then, oh, when I'm tired or when the brain has to exert more effort to keep things clear and single, and understand the world, oh, that's when I get tired more easily, and that's when I start noticing that I can't really understand what I'm seeing. So it's more the disruption that happened after a concussion. And that's something that over time, it also can be trained. It's more us taking the time to say, okay, you know what, if the memory part, the visual memory part is affected at this moment, there's ways of like maybe visual memory games that we do in vision rehabilitation to get the brain to kind of notice this. And then, of course, we make it a game, make it harder every time, so that we can slowly regain these strategies, and go
Yeah,
from there. So
that
be patient. That's the main thing, pace yourself, be patient with this.
yeah, I think one of the things that is helpful is when I have the time to kind of like sit there and process what I'm seeing. And, as somebody who was very high masking neurodivergent, I kind of start to notice there's this expectation of like, okay, respond now, or, and learning how to advocate for myself is still I'm still trying to figure that out. So for the neurodivergents, that whether they did have a concussion or they're experiencing this block, what are some ways to verbalize, just like the processing to advocate for ourselves in something like that?
Well, before we look into this part, we also want to understand. I think one of the main things I would say is to understand that that's the way things are processed, the things that are it's very structured, you've coped, you've had strategies that work well for you over the years, when it comes down to structure and organizing and how to interpret the world, especially even environments around you. Okay. So what happens is that when let's say for someone who've had a concussion, we're working on the same brain networks where all this overlaps. When we're talking about, the environment is too overwhelming, or that I can't concentrate on what I'm reading, and it's difficult for us to focus because it's the same brain network is just being overlapped at this moment. And so to understand that process, because a lot of people, even for let's just say concussion alone, these are invisible symptoms. People from the outside won't know that you can't focus well, it's hard, or that the world is spinning because you look perfectly fine, right, to them. And so ADHD aside, concussion symptoms, many of them are invisible. If you don't tell them you have a headache, you look perfectly fine, and so when it comes down to someone who have ADHD and concussion, yes, some of the symptoms may feel more heightened. And that's something that once you understand this a little bit more, then it's easier to verbalize this to your healthcare practitioner or even to your friends and family members. Right. So when it comes down to, let's say, just ADHD alone, then these are the things, and this is more the specialist on that end will be more able to verbalize and advocate. But the idea behind it is that the brain is essentially organizing all the information. And when there is some kind of disruption, then it's going to have much more effort in order for the brain and the rest of the body to communicate more efficiently.
A little bit about me and what type of neurodivergence I have or am. Like, I'm ADHD, so autistic, and have ADHD. Being autistic wasn't really something I was quite comfortable talking about yet on a larger scale, pre-concussion, even a little bit after, because I was still learning about how that showed up in my life. And I was still trying to have the words for it. But the longer I was going through like concussion recovery, the more I needed to acknowledge the fact that I was autistic, because it made everything harder to explain it to anyone. Have you seen an overlap at all between whether it's autistics, people with ADHD, or both have prolonged concussion symptoms?
This is a really good question, because now we're not just looking at one thing, we are looking at the whole picture, and we are taking a look at which part is more ADHD or neurodivergent and which part is concussion, and why do I feel worse after a concussion. Now, as you know, anyone who are diagnosed or undiagnosed with neurodivergent characteristics, everyone has a different spectrum in terms of how they feel and how they relate to the world. So when we zoom out and we take a look at both perspectives and concussion, what I want people to really truly understand is that we are working with the same brain networks. And so there are things that are overlapping when it comes down to symptoms. For example, how we structure, how we organize information, how we understand the world around us. These are all an attention, concentration, these are all the same brain networks that are being affected. And so, symptoms, when it comes down to symptoms, it's very similar when it comes down to people who have concussion and people who have ADHD or neurodivergent characteristics. And so a lot of people afterwards would say, how come I feel worse than before? And is it because of is the concussion making my symptoms worse? Or another way of asking yourself, because you know yourself best, you guys know your baseline of how you feel before the accident. Now, what I want you to start thinking about is, okay, some of the symptoms that we're experiencing, yes, it's worse. And also, was all these also masked? Meaning that before the accident, there may have been visual difficulties that may have not surfaced. And this is not just for this population, this is for everyone who had a concussion as well, because if there were already visual discrepancies that were not surfaced after a concussion and it surfaced, that may make things even more uncomfortable. And so the answer for you in terms of does this prolong, recovery is a very individual basis when we talk about this. And what I believe is that once we start understanding the basis of why certain things happen, especially when it comes down to the vision portion of these symptoms, then we have an understanding of which direction we can have in terms of how to support our recovery and also our individualized treatment plans. So I want people to understand that, this is not a permanent thing, and that the brain can adapt. And when we're talking about adaptation, that's where all the science with neuroplasticity comes into play. And for those who don't know, but neuroplasticity just essentially means that the brain can change. And that the more we repeat something over and over and over again, and then we add in some challenges and weights, it's kind of like a workout, like I said earlier, then the more it stimulates specific parts of the brain and then fires and rewires certain neural pathways. And that, because at the end of the day, when we're talking about vision, we want it to be like this immediately versus, oh, things are blurry. Oh, things are clear. Oh, wait, I think the brain has to understand that that's single and not double. Oh, wait. Now things are in and out. Like we want it to be easy. And that's why I always talk about efficiency. So the whole idea behind, is it going to prolong my concussion? I would say because there's overlap, it can make it seem worse, or maybe it is worse. And to understand that over time, once we get the systems in place and we start understanding everything a little bit better, then the brain can adapt. Just like how everyone's been adapting beforehand, finding strategic coping mechanisms or finding a way where they are able to function better. And so these are things I want you to also consider.
Yeah, that's super helpful. Part one of the question is, how does vision and vestibular work together? And then the second part is there a difference in how the vision and the vestibular works when you're neurodivergent? And for context, the reason I ask is because I noticed as a former dog trainer, I attracted a lot of neurodivergents because of like what I talked about and stuff. And some of my neurodivergent clients used to really struggle with their balance the moment I asked them to like walk to a specific direction while also doing another task. And so the vestibular was already like, they had it.
So it sounds like, yeah.
I don't know if that
So
makes
it
sense.
sounds like the brain is unable to process that much effort at the same time,
Yes.
right? Because if, let's say, we're just walking and we're in balance, then yeah, that could be vision and vestibular. But when it comes down to, okay, now we're walking, balancing, and doing a multitask, And then that's when the brain says, you know what, it's too much of an effort for me. I'm just going to have to focus on one thing. And depending on what that task is, I may have to focus on that task, and then the balance will be off. Right. And so it depends on the individual, and it depends on the experience that individual have in terms
Yeah,
of the resiliency when it comes down to how the brain interprets and processes the information.
that
Does
makes
that make
sense.
sense?
Yes.
If we are doing multiple things at the same time, then the brain has to decide which one is more important for me at this moment to navigate the world and understand what's going on. And so if it's just walking, I'm always walking. But then now I'm adding another task, and maybe that task is not as familiar. That's when the brain has to choose, okay, which one is more easy? Which one do I need to focus on? And which one is stimulating my nervous system in the sense that I need to focus on that? And then that could be, another perspective of seeing it, and now the person feels more in balance because the brain is not focusing on trying to keep balance. Now the brain is focusing on another task,
Yeah.
and that task could be something that the brain deems more important at this moment for survival or for how you feel.
Yeah. That makes sense. Especially once I ask them to like focus on one thing and track it. I mean, sometimes it helped. And then there were other times where like if there was too much going on in the peripheral, targeting made it worse.
So actually, that is what we do in vision therapy, because we're not just doing one activity at a time. What we're doing is we're saying, okay, well, now let's add in other activities and let's make the brain work a little bit harder. Let's challenge it. So when I'm talking about like adding a weight to your workout, what I'm talking about is, okay, so let's do one task where you're tracking an object, you're keeping your head still, and now let's make it harder. Let's get you to walk a straight line while you're doing it. Or, okay, let's make it even harder. Let's have a balloon floating around in the periphery. Let's have someone throw a balloon, around, because now your peripheral is stimulated and you're walking and your environment is moving and you need to keep track of that object. And let's make it harder. Now I want you to hold on to a book and read one sentence and then read the something that's further away while walking, while a balloon is moving. Like, this is how we step it up slowly. And and here's the thing, you don't go straight into that. And this is why people who have concussion, we don't it's harder for us today say, okay, let's do group therapy, because it's so individualized. Everyone feels how they feel their symptoms differently. And so we have to really pay attention to how that person feels, because at the end of the day, if we push that individual too much, then we don't want them to fall off the cliff or fall and then take 5 days to recover. And that's not the point, because then you have a rebound effect, and then it will take much longer for the recovery process. For everyone here who's experiencing concussion or whatnot, understand that this we don't want to rush into recovery. We need to listen to our body and also to take things one step at a time. And also want people to understand that progression and recovery is not linear.
Hmm.
There may be days where you don't feel like you're progressing and you're recovering, and it does not mean that you're not recovering. You are actually still progressing. And so it's not linear, and to pace yourself when it comes down to your recovery, your individual recovery journey.
Wow, this has been so educational that everyone can benefit from whether or not you've had a concussion. How can people connect with you more, and how can they find you?
Well, first off, I want to say thank you. Thank you for having me here today. You can find me on Instagram with the handle at Dr. Lisa Chow. For those who want to continue the conversation or they feel like, there's something specific and they want some more clarity, I am opening up one-to-one brain vision clarity calls, and we can discuss a little bit more and go with that from there. And that's also on my page that's linked below. For those who wants to talk more about this in a group setting, I am opening up my brain vision community where we will talk more about different types of topics as it relates to the brain and vision. And I will share that link as well. Thank you.
Awesome. Thank you so much, Dr. Chow. You have been awesome. I love your energy, and I'm so grateful that you took the time to talk with me and just dive into it in a very honest and transparent way. We need more doctors like you.
Oh, thank you. Thank you so much for having me on your show.
Thank you for anyone who is watching, and more information will be linked below.